I founded Us Against Alzheimer's 3 years ago because I was so frustrated at the pace and lack of urgency and the absence of any passion or emotion around this issue. And I think we're finally beginning to get there. Working with the association, we did get a national Alzheimer's plan, and we've gotten a goal in the United States of preventing or effectively treating this disease by 2025. And now my organization's, the Global CEO Initiative on Alzheimer's, is working with the UK government to do this at a global level. But today we're talking about long-term care. What is striking is that coincidentally, yesterday, there is a Commission on Long-Term Care established by the United States Congress with an intense 3-month period of service, which ruined my summer, to try and get at how in the United States are we going to deal with this precise issue. What is quite apparent to everyone is that we have developed a healthcare systems in this country that's developed on an acute care model. You get sick, you go to the doctor. You get really sick or have an accident, you go to the hospital. Then you get discharged, you go home. And there's no particular continuing activity that is associated with what happens when you go home. So unless you happen to need skilled nursing facilities, skilled nursing services at home, you don't get anything. Now, we do have Medicaid, which is basically 50 Medicaid systems. It's not a single United States uniform system. Very uneven benefits, basically for impoverished populations. But for the vast majority of Americans, there is no public benefit system that responds to the need for long-term support and services. We have a system that's essentially medical in character and not one that has social components to it. So there's no transportation support, there's no housing support, there's a wide variety of social supports associated with this. And if you begin to look at the resources available in a community around those other social supports, it's very difficult to find them. And it's terribly siloed. Medicaid with its 50 different systems, Medicare that doesn't really deal with this issue at all, and enormous variability. So this report yesterday dealt very much with caregivers. It very much is the backbone of the service delivery system and the need for additional information, education, and support for caregivers because absent those caregivers, not only would we have a fiscal disaster already in motion, but the notion that we would somehow substitute paid caregivers for every family caregiver is just inconceivable, both because of the supply constraints on labor as well as the costs. Big debate on financing. How would you finance a long-term support and services benefit in this country? You know, the Republicans think we can do it by incenting private long-term health insurance. That has not proven to be a particularly effective method, only a slight penetration of long-term care insurance products. Can we enhance people's savings? And there may be some tax benefited ways to increase savings. But the fundamental fact is that Americans are not prepared for their retirement. They have not saved enough, don't have long-term care insurance, and in fact, they, in the middle class in this country, in 10 to 15 years, is going to get impoverished and put impossible and crushing burdens on the Medicaid system. I'm going to speak specifically to a couple specialized populations. Women are disparately impacted by this, as we all know that. We're disparately impacted because they're 2/3 the victims of caregivers, they're 2/3 of the caregivers, they're 2/3 the victims of Alzheimer's, 2/3 the caregivers. But even if you look inside the caregiving responsibility, women do something different than men. Men will help with the transportation. Men will help with the financial and bill paying kind of activities. Men will go get groceries. Women are the ones that do the intimate care, the emotionally burdensome, the physically difficult care. So women bear a disproportionate burden on this. And of course, women have gone into the workforce in droves, and the fear is that they're not going to come back to the caregiving home, or we are going to put a huge dent in the women's movement. We're going to suck women out of the labor force because their primary love of life is going to be a spouse or a parent and not work, which means that we may expand our informal caregiving support, but we're going to do it at severe damage to the women's movement that we've been so successful over the last 50 years. African Americans, twice as likely to get the disease. African Americans in this country bear 1/3 of the economic burden of everyone. So $210 billion for this disease, $70 billion for African Americans. The disparate impact on specialized populations is just extraordinary. So I'll stop there. in light of
You had to mention the guys going for groceries, right? When you look in the eyes, because you do this, you walk up and down and talk to senators and congressmen and policymakers. Can you give us, what is it that you say to them when you actually finally get them to pay attention? What do you say? I mean, how do you, everybody has so many things on their plate. What do you say to get them?
I talk about the extent of human suffering, but for, quite frankly, there's usually someone behind me in a wheelchair with ALS, and there's someone with a guide dog, and somebody with a wheelchair with some other condition. So human suffering is broader than Alzheimer's. The cost of the disease is obviously something that gets their attention because we invest $500 million a year against a $210 billion cost problem.
$500 million for research.
$500 million for Alzheimer's research against a $200 billion cost problem for the country. Any CEO who had a $200 billion cost problem is spending $500 million again in the research to avoid that would get fired. Unfortunately, we can't fire Congress. We could fire Congress if, in fact, we get the American people mobilized. And you know what's striking is that we started an HIV/AIDS effort 30 years ago. We started a breast cancer movement 30 years ago. 30 years ago was about when we really began to pay attention to Alzheimer's as a disease rather than the natural course of aging. Look what's mobilized the HIV/AIDS movement. Look at what's mobilized the breast cancer movement. We have not mobilized the American people around this disease. Now, in part, that's the population. They have a hard time speaking for themselves. You know, fortunately, we're beginning to change that a bit. The caregivers are pretty exhausted. They can't go, you know, spend a day on the Hill. So a lot of us, the name of my organization is Us Against Alzheimer's. It's all of us that have to begin to speak for this extraordinary large population. But what the congressman will say back to me is, there's a lot of problems out in the world. Would you take the money away from Pell Grants for college education? Would you take this away from food stamps for those in the country who are hungry? Where are you going to take the money? In a situation where we don't have any more money, where are you going to take the money? You want to take it from cancer? You don't really want to take it from any other disease. But where's the money going to come from? Francis Collins at NIH is a hero. Francis Collins is using every discretionary piece of energy at his command to allocate additional funds to Alzheimer's research because he sees the burden and the unmet health need, but he also sees the scientific excitement around this disease now. But he is a hero. The FDA is shifting its position to be able to evaluate drugs in populations that don't have symptoms. They're shifting. Medicare is refusing, at the moment, refusing to reimburse for a new diagnostic technique, which is, they're the odd man out in this government in terms of the policy. Everyone else is falling in behind the whole effort around the National Alzheimer's Project Act and the national plan, except right now, Medicare. Well, first, it's going to take an end of sequester. This enormous and continuing fight over the level of the government budgets is interfering with any ability to set priorities. So first we have to get rid of the sequester. And then we have to persuade, among all the other priorities, from financing college education to food stamps, that Alzheimer's and Alzheimer's caregivers need financing and need support. Well, there are some evidence-based programs of how to educate, train, and support family caregivers, which alleviates their suffering, enables them to do a better job at what they do, and delays institutionalization of the care recipient. And so the education, training, and support for family caregivers, tying them into the whole care team is, I think, essential to getting the family caregivers the support they need and the country a cost mitigating strategy for how to deal with the tsunami of Alzheimer's victims. I think they just need some support. They need some education as to what to expect with respect to the disease. They need some training on how to deal with the behaviors of a family member. And they need the support through respite and other options that enable them financially and emotionally to deal with the extraordinarily long and painful journey that they go through with the care recipient and to be able to maintain their own health. So the message to them is, think about them too. If I'm a caregiver, I need to think about myself.